I'm here to speak to you about the virtual integrated clinic offered by Medindia. This application has been developed in compliance with the Telemedicine Practice Guidelines, which was passed by the Government of India and gazetted on the 14th of May 2020. Telemedicine itself has been included in the Indian Medical Council Professional Conduct and Etiquette Ethics Regulation of 2002. The Indian Medical Council obviously is called the National Medical Council now. And this has been included in the Chapter 3 under 3.8.1 as an annexure to called Appendix 5 in the Code of Conduct. So telemedicine today is allowed by the Indian Medical Council, and a registered medical practitioner who is eligible to start. I'm here to speak to you about Medindia's integrated virtual clinic, a product which helps to connect doctors with their patients. It is more than just a product. It provides doctors and the patient a platform where the patients get a personalized wellness page related to their condition. And the doctor gets many applications to help them not only with their practice, but also with enhancing their knowledge. This is a very powerful product, and I'll tell you about this in the next 20 minutes. This product has been developed in compliance with the Telemedicine Practice Guidelines, which were passed by the Government of India in 2020. This was not only passed, but also gazetted and notified on the 14th of May, 2020. Telemedicine itself as a practice has been included in the Professional Conduct and Etiquette and Ethics Regulation of 2002 and Chapter 3. So the Chapter 3, 8.1 says consultation through telemedicine by registered medical practitioner under the Indian Medical Council Act of 1956 shall be permissible in accordance with the Telemedicine Practice Guidelines contained in Appendix 5 of Code of Conduct. And it also defines a registered medical practitioner as someone who is registered under the Indian Medical Council Act of 1956 or is enrolled in the state medical register of the Indian Medical Register under the Act. So either of that, whether you're on the state or the Indian Medical Council register, you're entitled to practice telemedicine. What it means is cross-state telemedicine is allowed. You will not necessarily be registered in another state to provide teleconsultation services for a patient. Medindia's one-stop solution provides teleconsultation, as I said. The technology solution, you can manage both teleconsultation and in-person consultation. And as I said earlier, it provides the patients with customized health and wellness information that is white labeled in the doctor's name. This whole application creates efficiency for patient management, for the retention. It provides them with aftercare once they leave your consultation room, and that's very important. Why Medindia captures essential details of doctors? This is as per the Telemedicine Guidelines by the Government of India. And in Chapter 5 of the guidelines, it says the technology platforms enabling telemedicine should ensure that the consumer are consulting with our registered medical practitioners who are registered with the National Medical Council or their respective state medical council. And technology platforms shall conduct due diligence before listing any registered medical practitioner on its online portal. Platform must provide a name, qualification, and registration number, contact details of every registered medical practitioner listed on the platform. And that's why we collect essential details of doctors before signing them and making them verified premium members on Medindia. As per the guidelines, as I said earlier, an RMP who is registered with the National Medical Register or State Medical Register can do cross-state consultation without having to register in another state. But across the border consultation at the moment, the guidelines don't say don't do it, but it does not give any guidelines for you to follow on these. So if there's if you get into any trouble, it's for you to sort it out. What are advertisements for teleconsultation? If you look at advertisement, generally it has three components. One is to inform. This is allowed. To remind, like appointment, this is again allowed. But to persuade is not allowed. So the telemedicine guidelines also say, do not solicit or advertise or give inducement for teleconsultation. A RMP should not insist on telemedicine when the patient is willing to come for in-person consultation. So this is very clear regarding advertisement. What you're allowed to do is, you're allowed to say on your prescription, or you can tell your patient that I am available for teleconsultation. What you're allowed is, you can send them a reminder if they have booked an appointment with you, that you are supposed to come for teleconsultation with me at 6 o'clock in the evening or whatever time. So this is possible. We also help you to get certified for telemedicine practice, because the telemedicine guidelines itself says that all registered medical practitioners intending to provide online consultation need to complete a mandatory online course within 3 years of its notification. What it also means is that you need to be familiar with the telemedicine guidelines before you do teleconsultation. And Medindia has tied up with the Telemedicine Society of India, a 20-year-old society which is promoting telemedicine in this country. It is tied up and it has helped them to develop an online telemedicine course. This course covers the 7 elements for telemedicine consultation: the context of telemedicine consultation, the identification of both the doctor and the patient, the mode of communication, what you follow, whether it's going to be email, whether it's going to be video consultation, what kind of consent you require, whether it's implicit consent or explicit consent, the type of consultation which you do, like the medication which you write and so on, what you can write and what you can't write, what kind of patient evaluation is possible, and how to do overall patient management through teleconsultation. So all the 7 elements are covered in the course which is conducted by TSI, which is available online, which is available also on your dashboard. If you click on that area, you will go to the place where you can get certified for telemedicine practice and get to know about all the nuances of telemedicine practice. And this is the course. In fact, we recently started also a course on diabetes and telehealth. Sorry, diabetes and telehealth. So let's look at this integrated clinic from a doctor's perspective. Normally, a doctor's dilemma and challenges are, when it comes to webbing, are these. One is they don't necessarily have a digital presence. But many times, a doctor finds that the patient's engagement is episodic. And once the consultation is over, they don't get to see them back. This is a very common problem in our country. Well, we don't have a national health system. The patient is not registered under a practitioner. So they jump practice, from doctor to doctor, finally trying to find the right doctor. The doctors also feel that the chronic patients don't stick to them as well for a long time, like the ones who have diabetes or ones who have heart problem or kidney problem. They also jump. And as I said earlier, they don't have the right digital presence, especially today in this, when you have a pandemic like COVID, where self-care becomes important, home care is important, where social distancing is very important. So teleconsultation is one way of delivering health to the public and to the patients. So many doctors don't have the right digital presence. So the virtual clinic gives you a win-win kind of situation that empowers both you and the patient. So this is a verified homepage. You have a photograph of yourself along with a verified certification, what primary specialty you come from, what is the second specialty, what is your qualification, where you're located. And when you do a search engine search with the name of the doctor, then Medindia reflects very high on the search engine. And here it is, Dr. Sanjeev Nair, and his name comes up first on search engine. So the visibility of the doctor by digital presence is increased when you are with Medindia, because Medindia is a very high domain authority site, which means the search engines give Medindia a little bit more mileage than compared to other sites. So once you log in, this is your dashboard, and from there, this is your login screen where there's a doctor's login. There can be a new patient login or a returning patient login. A very simple screen. And when they click that, they go into the login page. And so when doctor logs in, he gets a dashboard of his own, and his profile is there. Then if there are online teleconsultations they're doing, that is available to him. How to manage their patients, to view their patients, their health records and so on. This is a icon for that. And for in-person appointment, clinic appointment, there's a facility available for the patients to do that as well. And then we also provide the doctors the latest abstracts in nephrology. Dr. Sanjeev Nair is a nephrologist, so all the latest abstracts in nephrology is provided, and the articles, links are provided. And then the upcoming conferences in nephrology. This is how they manage their patients. They click on, when they manage the patient, the name of the patient comes up, the email and phone number comes up. We have, for the purpose of confidentiality, we've hidden all that, and the doctor can view them. They can see who has registered, who has not registered. The patient can book an appointment with the doctor, both for teleconsultation and for in-person consultation. When is the doctor available for appointment? That slots are what are available also is reflected on the page. The patient can also get reminders for appointments and medication. And then we provide the doctor with an app for teleconsultation, which is linked to the payment gateway. So that was the doctor's perspective. Let's look what the patient gets when they get an integrated clinic. So the doctor's patient. So let's look at the dilemmas and challenges of the consumer now. So the consumer's point of view, most of the information out there is not relevant to their condition. There's information overload, as you know. They're not sure how to manage their chronic condition on a regular basis. They're confused many times. They don't know which doctor to consult. So there are different sites for different problems. There's one site for their problem, one site for doctor consultation, and then there's something else for post-care. They're all fragmented information. So the patient wonders, how do they find trusted, relevant health information in one place so that they can take action to improve their health? And this is where Medindia helps them in their journey. It not only creates awareness, it also about a medical condition, but they help them in finding the right specialist. It books an appointment for them, and it facilitates the consultation process. So it complete journey takes care of. The strength of Medindia is here. After the patient has left the doctor's clinic, till they come back, all patients are provided with this personalized wellness information for self-care and for post-care. This is a very much required for the patients. And Medindia works like a health information buddy as far as the patient is concerned. So this is what the patient gets, a personalized health information on their health topic of their choice. So if they are suffering from, let's say, diabetes, and they have some problem with the heart, so they'll get information related to diabetes, healthy heart, and if they want to take urology also, they can do that. So they can get information only all these conditions, nothing other than that. And then instantly, using our machine learning and AI, a page is created which gives them information only related to diabetes and the selected condition. That's why we call it, this is personalized My Health page. And here it is. It's white labeled to the doctor. It says Dr. Sanjeev Nair, Health and Wellness Portal. This is the patient. Login. So every day they'll get a health tip, a new health tip, which will keep them motivated, keep them to take care of their conditions. And this is information on their health page on diabetes. There's latest news, articles, their health tips, assessment of knowledge, and we also give them tutorials, short tutorials, to tell them about their health condition. So in the COVID times, all patients are getting COVID information, all consumers and patients. many inspirational health quotes. This is on olive oil. This is on quitting smoking. We also have provide them in other languages like Hindi. Patient gets a health diary. Right. They can do health risk assessment. The reports available on common health chronic diseases like diabetes, cardiac, blood pressure, and so on. This can be tracked over a period of time. If they wish to lose weight, there's a calorie tracker, and a diet tracker. Medindia provides them with an electronic health record. They can, put in their things like their allergies, their conditions, their illnesses, medication, the tablets they're taking, any procedures if they've had, the doctors they're consulting. If they have lab tests, they can upload their lab tests. And this can be printed out and sent by email. This is to upload their test reports on Medindia to send it to the doctors. As I said, they can track health over time. And then we provide reminders for appointments, for drugs if they wish. One of the powerful features of the patient side is providing them with video lectures on common conditions. We have more than 300 video lectures available. And this is on diabetes, self-learning videos, introduction to diabetes, understanding the value of testing blood sugar, understanding anti-diabetic drugs, diet and diabetes, insulin, and so on. So this is a short video of about 8 minutes.
$73 billion has diabetes.
One insulin-dependent or juvenile diabetes is diagnosed in children.
In type 1 diabetes, the pancreas does not produce enough insulin. Type 2 or non-insulin dependent diabetes is the most common type of diabetes in which the body does not produce enough insulin or the produced insulin does not function properly. Gestational diabetes, a woman who never had diabetes before and develops diabetes during pregnancy. This can also be developed. Cardiovascular disease or heart disease. High blood glucose level damages the nerves and blood vessels.
So this is a video on how to take care of diabetes, just to understand the disease. This is about an 8-9 minute video, graphically done, essential facts about diabetes. Similarly, this is a video on hypertension, again a very chronic condition.
What is blood pressure? The force exerted by the blood against the walls of the arteries is known as blood pressure. Blood pressure is usually expressed in terms of systolic pressure, which refers to blood pressure when the heart beats while pumping blood, and diastolic pressure refers to blood pressure when the heart is at rest between beats. Facts on 5 grams a day. Engage in physical activity, manage your stress, practice yoga and meditation, quit smoking and limit alcohol intake.
So this is again a 5 to 6 minutes video on hypertension. So we have well presented short videos for patient education, followed by an assessment of how much knowledge they've gained. And these are done with an idea of any interventions. If patient understands the disease better, they will manage the disease better, and they'll be healthier in the long term. And that's the whole idea of providing them with these kind of information. So a very powerful package overall for both the doctors and the patient is provided in virtual clinic at a very, very nominal cost, because one of the objectives of Medindia is to empower both consumers and doctors with authentic, trusted information for better health outcomes. So thank you very much. And we are based in Chennai. You're welcome to visit us if you are passing by in Ananagar to visit our office. Partner with us, help us take care of the health of the citizens of the country, to improve our health information. If you have any ideas to share with us, we are most welcome to do that by writing to us, very, very, very prompt in responding to any questions which come to us. So I wish you all the very best, and I hope that by using the virtual clinic, you will be empowered and you'll be able to take care of your practice Thank you very much.